I want to start off by welcoming everybody. Thank you very much for joining us for this open mic. Today we are joined by Janine Clarke, who is the chief within the physical and biospecimens measures at Statistics Canada. She's going to talk to us about one of the coolest surveys, I think, in the RDC, because it's not just data. There's also some physical specimens that can be requested to go along with it. So, a little bit more of a biology audience than maybe we're used to. But still, very cool survey, and we're interested in learning a lot about it. Today's part of our open mic series, which means that we're looking to hear from you in an involved Q&A session. We've got another open mic coming up on the Criminal Justice Relational Database in a month's time in October, which also features some linkage to the hospital records that you're familiar with in the RDC. So for the health audience that are here today, if there's any interest in sort of how that overlaps with justice system involvement, that's a cool data set to check out. We also have a presentation on the fundamentals of OCAP from the FNIGC coming up in a month, or sorry, not in a month, next month. So if you're interested in that, that's also, like all our events, is free, and you can join us there. Before we begin, I'd like to acknowledge that McMaster University is the host institution for the Canadian Research Data Centre Network. The university is located on the traditional territories of the Mississauga and Haudenosaunee Nations and within the lands protected by the Dish with One Spoon Wampum Agreement. We're beginning this session by giving honor and thanks to the Haudenosaunee and Anishinaabe nations and to recognize our responsibility to respect and honor the intimate relationship Indigenous peoples have to this land. You can visit Native Land Digital, a space where people can learn more about the lands they inhabit, the history of those lands, and how to actively be part of a better future going forward together. And without further ado, I will repeat my request that everyone disable their cameras. And Ryan, if you can pop through and disable people too, we'll give Janine the full floor, and we look forward to hearing from her.
All right, thanks, Grant. Just let me get my presentation up here. So, that's what I want. No. Sorry, just trying to find the way that I'm going to be able to advance the slides while I talk. There we go. Okay.
Perfect.
Yeah, hi. I'm here to talk to you a bit about the CHMS, and I love that Grant is so excited about it because I think it's one of the coolest projects out there too. I'll just introduce myself a little bit shortly, and then I'll give you an overview of the survey itself and some of the content that it has. And then given some of the sort of interest that Grant suggested, I'm going to go through some of the tools and resources that are available to be able to better plan out some of your analysis. And then there is option to go through more specifics about analysis itself, but I'm kind of thinking that we won't really have time to get to that, but happy to answer any questions along the way. So just very quickly, I am the chief right now of the Analytical Insights and Dissemination section in the Center for Direct Health Measures. So alongside the CHMS, we actually are working on several surveys with different health measures. So we just had one survey that's questionnaire-based, the Canadian Oral Health Survey, and also a survey among oral health care providers. And then we also have the Canadian Wastewater Survey, which measures certain drugs and viruses in wastewater samples from across the country. So my section actually handles a lot of the dissemination and analysis for all of the surveys within our center. Just a bit of background, I do have a background in kinesiology, and I did a master's in physical activity epidemiology using some of the data from the CHMS. And I've also been a certified exercise physiologist for a number of years, but certainly not in any clinical practice at all. But ultimately, I've been CHMSing since 2008 is when I started with the project. So that's back when we were in cycle 1. And aside from a couple of small assignments along the way, I've been working with the data almost daily ever since. Oops, up here. So the CHMS is an ongoing national health survey that is a really good complement to other data sources because it collects direct physical measurements, and so that's what really makes it very unique from all the other surveys at Statistics Canada, which are often just questionnaire based. We do this by going around the country in a set of mobile examination centers, which we call them, or trailers, and invite people in to carry out a number of physical tests. So everything from height, weight, and blood pressure. There's been various fitness tests, and we also collect blood, urine, and we've collected saliva and hair samples to be able to test for a really, really large number of nutritional markers and cardiovascular markers and environmental contaminants. Globally, we're able to look at a number of important health issues because we collect a lot of information that contributes to more complex conditions than what you might be able to gather from a questionnaire. So things like metabolic syndrome and levels of environmental toxins and physical activity, which we directly measure. So it adds a lot of value above and beyond what a questionnaire can do. So unfortunately, the videos are not actually loaded in here, but this is just to give you a sense of what the trailers look like. So there's these 3 trailers that are attached together with pedways, and we set up the different spaces, the rooms within, to accommodate the tests that we need for any given cycle. So it's a pretty small and confined space, especially when people are doing tests that might involve some movement, like some of the fitness tests. We've had jumping tests. And then there's even a space dedicated right now with a dentist chair for an oral health examination. And then there's even a dedicated laboratory where they can actually receive the blood and urine samples and do some of the preliminary splitting of samples that needs to be done before it can be shipped off for testing. So in general, our target sample size for a given cycle is about 5,700 people. It's varied a bit over the cycles. Somewhere between 56 to 6,000 is typically what we get in a cycle. Originally, we started covering just the age group of 6 to 79, but in cycle 2, we brought that down to include 3 to 5-year-olds. And then in cycle 7, which is the current cycle, we also added 1 to 2-year-olds. Now, obviously, not all the age groups do all of the tests. Our 1 to 2-year-olds are pretty limited, but we are doing blood and, I guess not urine, but blood samples, the dental examination, and some of the anthropometric measurements. Now, because it's a relatively small sample size compared to a lot of our other health surveys, it is really only meant to provide national estimates. For logistics reasons, we don't go into the territories. It just would be very, very challenging to get those trailers up into the territories. When we say national, it's really estimates across the provinces. But of course, we do collect the direct physical measurements, adding value, as I said, and it is, of course, a voluntary survey. But we do typically, if we can get in the door, we do get pretty good participation, especially if getting people to complete the questionnaire. If they do that, they're very, very likely to go through and go to the trailers to do the physical measurements for us. So this just breaks it down a little bit more. So there is a household questionnaire, which currently is done completely in person. So we do still have interviewers that physically go to people's households to complete the questionnaire with them. And then once that's completed, they do try to book an appointment for them right away to go to the mobile examination center, which is where there's additional questionnaire and then all of the direct measures and the blood and urine samples. The other really interesting element of the CHMS, which Grant alluded to, is that we take some of those blood and urine biological samples and we store them in a biobank. So this is a laboratory in Winnipeg that's run by the Public Health Agency of Canada. So they actually store samples for us, and researchers can apply to make use of those samples to carry out new tests of elements that can be found in blood and urine, and then that gets added into our database of available data for researchers. In terms of content, we have over the years covered a really wide range of health topics. The questionnaire itself is always built to align with the direct measurements that we're doing. There are certain topics that are pretty standard across all of the cycles, some of the more important sociodemographic characteristics, but some of the more specific details on different food intakes or different physical activity questions, those might vary a little bit based on what is included in our direct physical measurements, because we try to include questions that do have a direct link and a direct purpose relative to the physical measurements. So as I've mentioned, the content of a given cycle, it does change. Typically, the way that it's worked is 2 cycles typically contain very, very similar content. And the reason for that is that it allows to combine those cycles together, which is something else that I'll talk about a bit later, but it does allow to be able to boost sample size for analysis. And it's also, there's a lot of cost associated with having to make changes within the trailers. And so it just makes sense to be able to continue with a lot of the measures for a bit of a longer period before making any changes. So there have been things that have been constant across all the cycles. So that's a lot of the more core measures, we call them. So height and weight and blood pressure, the lab measures, and then usually there's been at least one physical fitness measure, and then other more other themes have cycled in and out. So in earlier cycles, we had an aerobic fitness test that was in cycles 1 and 2, and then they came back again in cycles 5 and 6. And then in cycle 3 and 4, we had some hearing tests, which included the use of a sound booth. In cycles 5 and 6, we added vision testing. And then the laboratory tests do tend to change quite a bit too over the cycles. But again, there is some content that remains standard across all of them. So when it comes to planning your analysis, I'm going to go through, it's mostly about just what documentation is more readily available to use, because I know that not everybody has access to the specifics of what's in the data, or even just what the content is. So, one of the first resources, of course, is through the StatCan website. So the survey has a dedicated page that contains a lot of information about what's been in each cycle of the survey. So if you come up on the main page for the survey, if you go under definitions, data sources, and methods used, that's where you're going to start to find a lot more details about the different cycles and what's been included. So this is what the main, we call this the IMDb page. This is where all of the crucial survey information is kept. So, I mean, this will give for each cycle specific details about the target population, the sample design. It'll highlight any changes that might have occurred between cycles. And then there is a link available to get to the questionnaires, which is probably one of the best resources available. Yeah, so this here, I just wanted to highlight that the questionnaires is going to be one of the best sources of information to understand what's available in a given cycle. But then we have a lot of documentation that's available upon request. So you can reach out to the centralized StatCan client services email, or I think a lot of this can even be requested directly from the RRDCs. But we do have a content summary, which I'll go through shortly. And there's the data user guide, which is a lot of the same information that's already available publicly on the IMDb, but then it goes into even more detail about specific protocols for the different tests that were available. It provides information about the data processing that was done and the method used to create the survey weights, and it's very, very detailed for each cycle. There's also derived variables documentation, which provides all of the specifications for how we derive variables based on either questions or measures that were collected. So, for example, BMI, we collect height and we collect weight, and then we calculate BMI, and then we use that calculated BMI to assign people into the groups of normal weight, overweight, and obese. So those are examples of what we call derived variables, and there's specific and very detailed documentation on each of those. There's also data dictionaries available, and there are versions available that can be shared. We call them rounded data dictionaries, and that's where you can see the actual breakdown of the different variables and the different levels and what the frequency counts are, because that's one of the key pieces in being able to assess sort of what's feasible for a given analysis, is knowing whether you have sufficient numbers to be able to either hone in on a specific group or focus on a subpopulation or whatever, because there's sort of minimum samples that are required when you get into the weighted analysis in order to get estimates that are of sufficient quality for use. The next one that's listed, the sampling documentation, that's an even greater, more detailed document that goes into how the sample is created and selected. It's probably less relevant, but certainly gives a good understanding of how we go about selecting participants for the survey. The next one that I highlighted, the instructions for combining multiple cycles, that one is a really good resource, and I'll get into that a little bit more also, because it provides basically a step-by-step approach of sort of assessing whether or not it's possible to combine cycles together to increase your sample size. But it also, raises really good points that are relevant if you're looking to potentially compare outcomes across cycles. So there's a lot of similar elements to consider, and I'll get into that more shortly. There's another document combining the weight instructions, and that's more specifying how you go about incorporating the data files together and working with the survey weights across cycles. And then we have a very, very extensive errata document, which is a really important one too. I should have highlighted that one because it highlights certain things in the existing documentation, like in the data dictionaries, or even things in the data file that are not accurate. So for example, something might have been mislabeled in the data dictionary, and so the errata document will highlight that, and it's just that we haven't had the chance to go back and re-release that data dictionary. It also highlights a couple of data errors. So I know in a DV, I think there was, you know, a misclassification, or the specifications for deriving the outcome were misassigning a certain groups. But so the errata provides specifications and code on how to correct that in your own data file. Okay, so the content summary. So this is probably the best and the best resource and sort of first step to be able to sort of see what's available in a given cycle. It's not as detailed as, for example, the data dictionary, which gives, you know, specific information about the data itself. The content summary is just very high level about what tests or what questionnaire blocks were included and in which cycle and for which target age group. So I think the next few slides here, yeah, I have examples here. So the colors basically just indicate whether it's something that we consider the core or base content, or if it's something that was a themed content that meant that it only came in for certain cycles or for certain age groups. And then, of course, blacked out just means that there was nothing for a given cycle. But so it lists the questionnaire blocks basically block by block. So it doesn't give you the full information about what was asked, but at least you know whether a given topic might have been covered in a given cycle, and for what age group. Similarly, for the direct measurements, it tells you what the different age groups are and what was included. One thing to note is that there are a lot of footnotes in the document, and that usually gives an indication of something like if it was collected only on a subsample, because sometimes for financial budget reasons, we can only, you know, some of the lab tests are very, very expensive. And so we only test about half of the survey sample for those tests versus some of the other ones that we do test everybody for. So yeah, there's some of the laboratory tests. The other one subsample that has always existed is a fasting subsample. So we ask about half of our participants to fast for somewhere in the neighborhood of 8 to 10 hours before their appointment. And that's to test for some of the like diabetes and lipid-related markers that are indicated here. And then this is just very high level, what we've collected and sent to storage for in the biobank. But there is more detailed information than this, but you have to request it from our biobank team. I think they're working on upgrading our website, though, to provide more information about what's available. So another great resource to look at is some of our published products. So one that I want to highlight is that we do have, can't remember if it's exactly 35 or if it's at least 35 what we call coder tables. So they're just our, you know, StatCan standard tables. And so, you know, we try to publish at least the main results for as much as possible every survey. And so if it's published in Coder, it's usually because it is a result that is, you know, there was enough sample and enough information for us to be able to publish some good quality numbers. And so that's usually indicative of whether it's a topic that could be looked at more specifically for analysis in a given cycle. So this list is what I pulled from the combining cycles document. But like I said, a lot of this would apply to whether you're trying to combine things together or whether you're trying to look at things potentially across cycles and making comparisons over time. So, finding out whether the variable exists in all cycles. So, I mean, you could think of that more broadly. So whether the test or the theme exists, but really you should be looking specifically at the variable just to make sure that it was the same, because typically, as long as it's the same or that we've deemed it similar enough, the variable name won't change. But sometimes we do change them just to indicate that there was enough of a difference that users should be cautioned when trying to combine them or use them together. So the other important thing is the concept or the wording for questionnaires, because there are a lot that have changed, and that's just with evolving standards, or if we get feedback that the wording of a question didn't seem to be well understood, we try to make improvements, even if it does mean losing some exact comparability. As if we think we're getting better data, we'll make the change to the questionnaire. The universe is the target population, so that's where that content summary document can be really useful, because that really tells you what age group was targeted for a given topic. And then more specifically, the list of response categories, because sometimes I can't think of an exact example, but we might have asked for people to list the 5 reasons that you stopped smoking. Maybe, I don't remember if that's even a question, but if we got a lot of other specified answers, we will sometimes review that and then add another category to the list of options, and that's just to be able to provide more detailed information in future. So that doesn't necessarily limit the comparability, but it does sometimes mean that you have to make some concessions when you're looking at your data across time. The data dictionaries don't really provide information, but this is just an example of a couple places. So these are just screen grabs from coder tables, but some of the footnotes, we've tried to put footnotes wherever we know that there is an important difference in the outcome that's been published. So a lot of the lab measures, for whatever reason, sometimes we make a change in matrix. So for vitamin D, we went from plasma to serum, or serum to plasma. And so that potentially has an impact on the results. Similarly, even if it's in the same matrix, sometimes a change in the laboratory testing method can mean that there's limited comparability between the results. So we do try to at least highlight that this might be possible. When I was reading these yesterday, these aren't necessarily the best footnotes or the most understandable ones, but at least it highlights that there are some differences, and so users should really be going to look at the documentation to judge for themselves whether they feel like it would be comparable between the different cycles. So I think I'll maybe stop there for now and maybe see if there's any questions. But then I do have some information that's more specific to doing the analysis that I could get into if that's something of interest.
Okay, so here's open mic, open part 1. I'll look for hands. If you're not super familiar with Zoom, if you go to the bottom of your window under reactions, there's a place to raise your hand. So I'll be looking for that. But just to get us started, I think as people in the RDC, we often kind of assume that, even though the data are meant to be sort of nationally representative, that, it's within the realm of plausibility that they're at least provincially representative. Um, but I can kind of see how maybe the way that you have to drive the trailers around and the way things go maybe means that that's not a good assumption for the CHMS. So what would you advise people as far as, the provinces if people are looking to do a more regional analysis? Or is that coming?
I can't remember if that's in one of those slides that I kept or removed, but certainly we have explored that because we do know the value of what we have, and there's definitely interest in understanding that at the provincial level. So there is some guidance on that in the document, especially in the combining cycles document. The problem, though, is that the sampling is done by region, not by province. So for a region like Ontario or Quebec, where the region is the province, within a cycle, you could look to see at, okay, what were the collection sites, and do you feel that might be representative of the population? Combining cycles is definitely better, and it's been done. I know we've done some custom tabs, and I know I've seen some other analysis out there looking at Ontario and Quebec specifically. The other regions, though, are tougher because BC, for example, which is another one where the region is the province, but we typically only have 2 collection sites in a cycle in BC. And so when you get into doing your analysis and you have to specify degrees of freedom, which is in this more technical part, you only have 1 degree of freedom to be able to calculate your confidence intervals. So then they get really wide, and the question of it, how meaningful is this, comes up. And then for the other regions, so the prairies and Atlantic, if we haven't been to Saskatchewan, for example, like we often go to Alberta at least twice, and then it'll be sort of one of Saskatchewan or Manitoba. So then the question becomes, how representative is that if we haven't even been to all of the provinces in a given cycle? So long story short, it's doable to some extent. You typically need to combine cycles, but there's still a lot of limitations and kind of question on, how representative is it really at this level.
Okay. And I see in the chat sort of a follow-on question is, if we're looking at sort of the top 5 CMAs, is that within the realm of possibility, or is that sort of a write-off given what we've just said?
No, we are actually right now internally looking into, is there any meaning at the site-specific level? But the problem with the collection sites is that because people need to come to our MEC, there's a limited radius, so it doesn't necessarily cover an entire CMA even. It might, the site names that you'll see will be like Toronto North or even Ottawa East. So it's not sampling from the entire CMA. So, and the weights are certainly not built to do that. But like I said, we're looking into, is there some meaning that we could get out of this at a smaller level of geography? But it's to be confirmed.
Okay, so now we're getting a few questions here. So there's a couple of questions that I'm going to smash together. So if we're doing a subsample analysis on immigrants or refugees, is there, and you're going to get a few of these questions, and it's totally valid to say no comment because you've pointed us at all these documentation. But given that you've been working with it for 16 years, sort of immigrant population, refugee population, is there enough there to kind of look at that, or?
It's been included in a lot of analysis. I know like even I've done some where we've looked at, more recent immigrants compared to, immigrants that arrived a longer time ago, or I know just from a socio-demographic perspective, different, population groups, there are some that there is some sample size that you can get into, but like a lot of other surveys at StatCan, these are not factors taken into consideration when we do our sampling. So, it's important, I think, to look at the distribution of that sample within the larger sample and see how that compares to, what we know from census, and then evaluate from there whether it would be appropriate, or whether it would really be appropriate to do. Or of course, it's a known limitation. It's often noted as a limitation that, it's not designed for this, but there is a sample in there. So
Okay, so 2 more questions. The biobank to the survey sort of relationship, those are tagged with a participant ID, and those 2 things are matched. Is that the correct statement?
Yeah. So everyone that fills out the questionnaire is the same person that goes to the examination, the same person that provides those samples. So we do have a unique identifier across the board that helps to link those data sets together.
Okay. And just Pamela, it's not everyone gave all the samples, right? Just coming back to Janine's presentation. So there's some samples that are only given or only taken from part of the sample, so you have to check the documentation to figure that one out. Is the CHMS linked to the census, or is there any plans to link it to the census? Or is there any plans to?
Census hasn't been on the radar, but in the RDCs already, cycles 1 to 5 are linked to the mortality, the deaths database, to the discharge abstract database, which is hospitalizations, and to the cancer registry. And there have been a few projects that have worked with that. It's limited so far because our sample is so small, and they've only been linked up to 2019. So it's we're behind in terms of available data, but there are some linked files available, and some analysis has been possible. I know sometimes I saw a presentation where even if the results weren't necessarily significant, it was showing in the same direction as what was expected from the literature. And so we're still getting some meaningful information out of it.
Okay. And then sort of, I guess maybe if you could give us just your high school essay question version of sort of comparing and contrasting the CHMS versus the CCHS.
Yeah, that's a good one. We've often had to kind of question that internally because we both publish often or on similar topics, and they both have their place and their purpose. The CHMS, actually, I'll start with CCHS. So CCHS has the benefit of, because it's questionnaire only, there's a much larger sample. And so it is designed to provide estimates at a much smaller level of geography. So that's one of the great benefits of the CCHS. So, there's a lot of results published, not just at provincial, but at CMA or at health region level. The CHMS obviously provides a lot of information at the national level that the CCHS can't. But the other thing that we've been able to understand from CHMS is often the differences between what people self-report and then what we've measured. So, for our lung function test, like there was a pretty big population or proportion that measured as having lung function consistent with COPD, and that was much greater than the number of people that responded saying I've been diagnosed with it. So it helps to understand in some cases levels of potentially undiagnosed disease, but then it also has helped to sort of better understand relationships between some measures. So with physical activity, you can, the self-reported provides a lot of information about maybe what types of physical activity people are getting, whereas the accelerometer that we use, it shows a discrepancy between what people report and what they might actually get. But both those pieces of information are really important to be able to understand the global relationship of physical activity with health outcomes. So yeah, they both have their place, and they complement each other really well, I think.
Okay, so I'm gonna just, they're coming fast and furious, so we might as well
Yeah,
keep going.
no kidding.
Given that you're collecting the gross revenue of the participants, I mean, I know obviously there's part of the reweighting is to deal with that, but can you speak a little bit about how representative sort of the data are, the raw data are, sort of maybe before that reweighting takes place?
Sorry, I don't know that I quite understand.
Okay, so the raw data are sort of a selected sample of the population,
Yes.
right?
Yeah.
Part of the whole business of creating the survey weights that we see as analysts is, to kind of correct for, under response in some segments of the population versus others. So just, if we kind of forget about the survey weights for a second, how much skew is there in the raw data compared to like the population?
That's a good question. I actually I don't know that I've ever really looked into it. I don't know that we have any. I'm sure the methodologists have done some review on that, but I mean, even from the beginning, I've been working with the weighted data, and that's what it's meant for, and
Yep.
it
Yep.
certainly doesn't account for everything. But yeah, I mean, it's I mean, it's weighted to the population by age and sex, and I mean that's the best that we can do really
Yeah.
for now, and that's
Okay.
common across the
It
surveys.
is. It is. Yeah. No, just, hey, if you don't know, you don't know. That's
Yeah,
totally valid answer. So, and
yeah.
then, going back to the raw data, response rate for the survey, just overall, so
Yeah, so in general, our final calculated response rate has been about 55%, which I think has typically
that's
been
great.
in line or a little bit better than some of the other surveys. And I do think that getting a lot of the physical measures done, and we provide results back to people. So like I said before, like typically if we can get in the door with people, they're pretty likely to follow through and come and do the physical measures tests. That being said, we've been encountering challenges with this most recent cycle, which has been pretty consistent across a lot of surveys too. We're still in collection, so I don't know yet what the response rate is, but it has been more challenging since we've been back in the field this time compared to before the pandemic, which was the last cycle.
Okay, so recognizing that there's sort of 15 minutes left on the clock here in our time, do you want to go through some of your analytical considerations, or I'll let you drive the bus here.
Sure, yeah, I can jump in, and but happy to answer questions as they come up along the way. Where are we here? Dun, dun, dun. Yeah, so some of this is getting a little bit more into the specifics of sort of how you go about it, but then I think it covers stuff that's a little bit more theoretical too. But I mean, basically, these are the steps that you'd need to follow. Obviously, reading through the documentation and making sure that you understand what it is that was collected. What the questions were, what the methods were for the test or for the laboratory test. Understanding which cycles it's in and what age group. Obviously, all of that would be necessary to be able to plan out a research project. And then once you get your hands on the data, there's steps to follow to actually merge your files together. Because the thing with CHMS that's different from a lot of surveys is that we parse out a lot of the different components just sort of ease of management and ease of documentation. So in most cycles, the household questionnaire data will sit on one data file, and then most of the measures that were collected at the clinic are on another file, and then there's a separate file for the non-environmental lab measures, which is like the nutrition markers and the cardiovascular and lipid profiles and that. And then a separate file for environmental contaminants, and then separate files for subsamples. So the list is really long in terms of files to potentially read in and merge together, but they all merge on clinic ID, which is our unique identifier in the database. Step 3 that's there is that idea of combining cycles. So where in a single cycle, you're going to merge files together, sort of side by side. You're going to add on your different variables for your outcomes of interest. When you're putting cycles together, you're going to typically, stack them on top of one another so you can carry out some analyses. The next step would be to, if we haven't already done it for you, derive any variables of interest. So we do try to create a lot of DVs or derive variables to make it easier and more readily available for use. But even with that, step 5 also requires dealing with missing values, which are coded either as a non-response code or a don't know. And so those need to be handled before running any analysis. And coming back to derived variables, it's just, we try to, for example, for BMI, we have in the past provided the different classifications in children using standards from the States, using WHO standards, using a different international standard. So we try to cover sort of as much as we can, but we just can't do that with everything. So, if you're interested in a certain threshold for a nutritional marker, we might not have already created a derived variable. And so that's something that an analyst would need to do themselves. So this here, in terms of merging files, is just to highlight that because we have subsamples, it can make some of the analysis a little bit more complicated. One really good example is something like metabolic syndrome, where you need blood pressure, which is in that full sample blue circle. But then you also need fasted tests like insulin and LDL cholesterol. And so in order to really assess metabolic syndrome, it means you're going to be limited to that subsample, which brings down your sample size. So that's a situation where it could be really helpful to combine cycles together to boost that sample size again, to carry out analysis. The user guide and the combined document provides really good information about the analytical guidelines, but I mean, the sort of most important one is that, we do create sampling weights and the accompanying bootstrap weights to calculate your variance. And so it's really important to make use of those for any analysis, because really that's that accounts for the survey design and provides those nationally representative estimates that the survey was built for. And then something that is unique for the CHMS compared to other cycles is this notion of degrees of freedom. So I spoke to that a little bit before, but we have a really limited number of degrees of freedom because of the sample design. And so basically the degrees of freedom is calculated as the number of collection sites, which is our primary sampling unit, minus the number of regions, which is the strata. So I think, okay, I'll just quickly jump ahead there. So this is the specifics of the degrees of freedom. So this also, provides good reason to combine cycles, because when you combine cycles together, you essentially double your degrees of freedom, and that can provide with much narrower confidence intervals. But it also, if you're looking to do some more advanced analysis and building models, some regression analysis, it increases the number of parameters that you can include in that model. So there's a lot of benefit to combining cycles when you're doing analysis. So here's where I speak a little bit to the provincial or regional. So it is built for national, but like I said, there are some possibilities at the provincial or regional level when you combine data together. If you just let me go back, I'll just yeah, so some other basic advice for using the data. So like many other surveys, any estimates need to be based on a minimum of 5 observations per cell. And that's really, a pretty common rule in terms of confidentiality. My understanding is that this is the thing that RDC analysts will focus most on when vetting the data. And so it can be a limitation in terms of being able to use the outputs. And then for estimates that are okay and based on at least 5 observations, we really, really recommend providing confidence intervals whenever you're providing your estimates, so that other users, people referring to the analysis, get a sense of what the quality of that estimate is, because there are times when our confidence intervals can be pretty wide depending on what the outcome of interest is. And so, I mean, that's what that last point speaks to, is just because our sample is small enough to start with, when you do start wanting to drill down into things by age and sex and, I don't know, income and something else, that you very quickly run out of numbers. So that's why it's extra important to keep an eye on those minimum cell counts, but also to make use of those data quality indicators. Similarly, we recommend using some statistical methods that are more conservative, and to make sure that you're specifying the degrees of freedom. So there's a few that are recommended there. So those are the ones that we typically use in-house, just to make sure that we're taking a bit more of a conservative approach. It's speaking to degrees of freedom. So so for degrees of freedom, it affects the number of parameters for your model. So if you're working with one cycle and the degrees of freedom are 11, then you only have room for 10 parameters in your model. So again, you can essentially double that if you combine cycles together. Regionally or provincially, degrees of freedom, again, it's really important. So for a single cycle, since we do have usually about 6 collection sites in Ontario, you do have 5 degrees of freedom to work with, but that's, it's really still not very much. So combining cycles together that's where it can make it possible to get some decent estimates for Ontario, possibly Quebec, and then maybe the other regions, depending on how many cycles are combined. And so this speaks a bit to the question about immigrants. So like I said, it's you want to assess, compared to what we know in the real population, what we have in our sample before maybe moving forward with some of those more specific analyses of different subgroups. And then, so I mean, this pretty much brings us to time, but I just copied a bunch of other slides. I'm super happy to share this deck if people are interested, but I'll definitely answer any last minute questions if there are others.
All right. Anyone from the audience have any questions? I think we anticipated a lot of the analytical concern slides in our questions, which is always a happy accident. Okay, well, seeing nothing, before I do the auctioneer thing, I'd like to thank Janine, our presenter, and the audience for your attention. And you'll see a few thanks in the chat too. So I hope everyone has a wonderful afternoon.